And now the World Health Organization reports 2/3 of seniors with mental health problems don't get the treatment they need. Much attention is paid to physical health usually. Mental health, of course, equally important. So to talk about that here this morning, we have Dr. Neel, a geriatrician at UC San Diego Health. Good to have you here with us, Doctor.
Good to be here.
Yeah, I want to talk about this issue because with senior citizens, mental health may not be the priority. A lot of times, physical health is demanding enough. You have to go to all these appointments, make sure you're physically okay. What are you seeing in your office, in your practice?
Yeah, absolutely. You know, it's all about priorities in geriatrics. And I always say that a geriatrician's role is to focus on function. And that's the big thing that we care about, is if it's affecting our physical function in life, then that really should be the thing that gets the priority. And the problem with mental health is that it really can sneak up on you and cause problems. And not just mental problems. You know, there's a huge mind-body connection, and what affects us mentally can also negatively affect us physically and vice versa. And so while we often will focus more on physical health, if we give mental health the short shift, then it may wind up negatively affecting everything else in our lives as a result.
Where you won't want to take care of your physical health if your mental health isn't fully there, right?
Exactly.
Okay. And tell us about this age as far as people get older. What tends to happen when it comes to mental health?
Yeah, definitely. So as we age, mental health does present differently than when we're younger. You know, part of it is that we see a lot more issues surrounding loneliness, surrounding bereavement or grief as life events happen to us, as well as an increase in risk of issues with our memory. And some of that may be due to mental health issues. You know, a lot of times forgetfulness is a warning sign of depression rather than a warning sign of something like dementia.
Okay, didn't realize that. And then signs to look out for. I mean, for many people, we have aging parents, for example. If we're noticing, what should we be watching for to say, hey, maybe it is time to talk to somebody? Definitely.
Well, you know, forgetfulness is one of the big warning signs. Another big one is social withdrawal. You know, a common thing in depression, a common thing in anxiety and in memory problems is to withdraw, to not want to go to events, to be more isolative in the house, and things like that.
Which that isolation, the loneliness you said, could lead to more
exactly.
Of the depression.
It's this vicious cycle of a negative feedback loop.
So what can people do about it? What are some solutions if people are watching right now and they can totally connect with what you're saying?
Definitely. The biggest thing is to see your doctor, you know, and one great thing is that Medicare has actually recognized this as a problem, and in the annual wellness visit that everybody with Medicare is entitled to, it's required to actually do mental health screening as a part of that visit. So if you've never had one, ask your doctor to have an annual wellness visit.
Okay, a wellness visit to check on all these signs.
Exactly.
See if it's something that can be fixed. And with you, I mean, being able to speak to a lot of senior citizens, I mean, does that, having someone they can talk to, I mean, how big of a deal is that? How important is that?
It's huge.
Yeah.
Yeah.
Okay, so that's a good solution. We also want to put up this number, call or text 988 if you or someone you know struggling. There's the helpline, the national helpline, 1-800-662-HELP as well. Dr. Neel, real quick before we do have to go, as far as getting appointments, seeing people, professional help, is that available for senior citizens right now? We don't want them to be discouraged, right?
It is, absolutely. You know, there's definitely a shortage of geriatricians and geriatric psychiatrists, but we are working heavily to train non-geriatrician primary care physicians to be able to deliver this help. And so it's a matter of just asking for help, and the help is there for you.
Such a special, important part of our population that we want them to get the help they need. Thank you very much, Doctor. We appreciate it. We'll be right back after this quick break.